Something happens to blood pressure at night that most people with hypertension are never warned about. Not during a stressful meeting, not during exercise, not during any of the moments most commonly associated with cardiovascular risk. It happens in bed, in the dark, while the body is supposed to be recovering. For a substantial portion of adults over 50 with high blood pressure, nighttime readings are not lower than daytime readings, they are higher. The pressure stays elevated or climbs further during the exact hours the cardiovascular system expects to rest. The arterial walls are absorbing strain through the night without the person feeling a thing. No symptoms, no warning. Just silent, compounding damage to vessels, kidneys, and the heart itself. Clinical research has a name for it: nocturnal hypertension, and it is estimated to affect more than 30% of adults with diagnosed high blood pressure, the majority of whom have no idea it is happening. Here is what makes this particularly relevant. What gets consumed in the final hour before sleep has a direct, documented influence on what blood pressure does during those overnight hours. Not in some vague general wellness sense, in a specific, mechanistic, research-confirmed sense. Certain compounds consumed at night interact with the vascular regulation systems that determine whether blood pressure falls protectively during sleep or stays dangerously elevated. 3 drinks have the strongest clinical evidence behind them. This video covers all 3, what they are, exactly why they work at the biological level, and the precise timing and preparation that makes the difference between a noticeable effect and a wasted glass. The third one is the one most people guess last. It is common, widely available, and has been sitting in most kitchens for years. But the research behind its blood pressure effect at night specifically is something almost nobody has connected until recently. One more thing before diving in. For those who want to go beyond individual evening interventions and build a full nighttime cardiovascular protection system, there is a structured protocol in the description that covers the complete pre-sleep sequence, specific supplement combinations that amplify the vascular effects of these drinks, blood pressure medication timing, and the overnight routines validated in clinical research for adults over 50 managing hypertension without relying solely on prescriptions. The link is in the description below or pinned at the top of the comments. Before getting to the drinks themselves, it is worth spending a moment on why the overnight window is so different, and why consuming the right things before bed matters more than most cardiologists take time to explain. Blood pressure is not static. It moves through a predictable daily rhythm governed by the autonomic nervous system, hormonal cycles, and the renin-angiotensin-aldosterone system, the body's primary long-term pressure regulation mechanism. Under normal circumstances, pressure drops 10 to 20% during sleep. This drop is not cosmetic. It is the cardiovascular system's primary recovery window, the period when inflammatory markers fall, arterial repair processes activate, and the heart operates at its lowest workload of the day. When that drop fails to happen, when pressure stays elevated through the night, the heart never gets its recovery window. The arterial walls absorb continuous mechanical stress. Inflammatory processes that should be resolving continue running. Research published in the European Heart Journal found that nighttime blood pressure average is a stronger independent predictor of cardiovascular events, heart attack, stroke, heart failure, than daytime readings, even when daytime readings are elevated. What drives the failure of the nocturnal dip? Several mechanisms, including autonomic nervous system imbalance, overnight activation of the renin-angiotensin system, reduced nitric oxide availability, and endothelial dysfunction, the impaired ability of arterial walls to signal their own relaxation. Every one of those mechanisms can be meaningfully influenced by specific bioactive compounds consumed before sleep. That is the scientific basis for what follows, not general wellness claims, specific mechanisms, specific compounds, specific timing. Drink 1, warm beetroot juice, The evidence behind beetroot juice and blood pressure is among the most rigorously documented in the nutritional cardiovascular literature, and consuming it warm, before bed, targets the mechanism with a precision that most people consuming it have never considered. Beetroot is extraordinarily concentrated in inorganic nitrates. Once consumed, these nitrates are absorbed into the bloodstream and secreted into saliva, where oral bacteria convert them to nitrite. That nitrite is then swallowed and reduced further in the stomach to nitric oxide, the body's most potent endogenous vasodilatory molecule. Nitric oxide signals arterial smooth muscle to relax, vessels widen, peripheral resistance drops, blood pressure falls. The timeline of this conversion is what makes bedtime consumption strategically important. Peak plasma nitrite, and therefore peak nitric oxide availability, occurs roughly 2 to 3 hours after beetroot juice consumption. Drinking it 60 to 90 minutes before sleep means the peak vasodilatory window aligns precisely with the first half of the night, when the nocturnal dip should be occurring, and when, in non-dipping hypertensives, it is most likely to fail. Research published in the journal Hypertension by investigators at Queen Mary University of London found that a single serving of beetroot juice produced average systolic reductions of 10.4 mTs and diastolic reductions of 8 mmE, with effects persisting for up to 24 hours. A follow-up trial published in the same journal found that 4 weeks of daily consumption produced significant and sustained reductions in 24-hour ambulatory blood pressure, with the most pronounced improvements in the overnight measurement window. Warming the juice slightly before consuming it is not strictly necessary for the nitrate mechanism, but it reduces the likelihood of the gastrointestinal discomfort that some individuals experience with cold beetroot juice, which can itself activate a mild stress response that counteracts the pressure-lowering effect. 8 ounces. Slightly warm. Unsweetened. 60 to 90 minutes before bed. The next drink operates through a completely different mechanism and has clinical support that extends back further than almost any other dietary blood pressure intervention. Drink 2. Hibiscus tea. Few things in the nutritional research on blood pressure have as clean and consistent a clinical profile as hibiscus tea. The evidence spans multiple countries, multiple populations, multiple trial designs, and the findings converge on the same conclusion with unusual consistency. Hibiscus sabdarifera flowers contain a concentrated mixture of anthocyanins, flavonoids, and organic acids, most notably hibiscic acid and quercetin derivatives, that exert a pharmacologically meaningful inhibitory effect on angiotensin-converting enzyme. ACE is the enzyme that converts angiotensin I into angiotensin II, the molecule responsible for vasoconstriction and the signaling cascade that raises blood pressure. Inhibiting ACE is the mechanism behind one of the most widely prescribed classes of antihypertensive medication, the ACE inhibitors. Hibiscus achieves a measurable degree of the same inhibition through a completely natural compound. A meta-analysis published in the Journal of Hypertension, pooling data from 5 randomized controlled trials, found that hibiscus consumption produced mean reductions of 7.58 mT systolic and 3.53 mHg diastolic. Research on ACE activity across the day has found that angiotensin-converting enzyme activity follows a circadian pattern, peaking during the overnight hours in hypertensive adults. This means that enzyme driving blood pressure elevation is most active precisely when the body should be experiencing its protective nocturnal dip. Consuming hibiscus tea before bed targets this enzyme at its most active window. The inhibitory compounds are circulating when ACE activity is at its highest. The timing is not arbitrary, it is mechanistically deliberate. One additional property worth noting: hibiscus has mild diuretic activity, which contributes to its pressure-lowering effect by reducing fluid volume. This diuretic effect is gentle, not comparable to pharmaceutical diuretics, but it is a secondary mechanism that compounds the ACE inhibitory primary effect in a clinically meaningful way. 2 cups. Unsweetened. Brewed for 5 minutes at minimum to extract full anthocyanin concentration. Consumed 45 to 60 minutes before sleep. One important note for anyone already taking ACE inhibitor medication: the mechanisms overlap. That overlap can be used beneficially, but the additive pressure-lowering effect means the combination should be discussed with a physician before beginning regular consumption. The third drink is the one that surprises people most, not because it is exotic, because it is the opposite of exotic. Drink 3, warm milk with a specific addition. Warm milk before bed has existed as a folk remedy for sleep for generations. Most people have dismissed it as nostalgic nonsense. The research tells a more interesting story, particularly when the milk is paired with one specific ingredient that most people would never associate with blood pressure. Milk contains 2 bioactive peptides, casein-derived tripeptides, that have been identified in clinical research as natural ACE inhibitors. These peptides, designated VPP and IPP in the literature, are released during the digestion of casein protein and exert a direct inhibitory effect on angiotensin-converting enzyme. A meta-analysis published in the American Journal of Clinical Nutrition, covering 12 randomized controlled trials, found that regular consumption of these casein-derived peptides produced statistically significant reductions in systolic blood pressure, with the effect size increasing over time with consistent consumption. Milk also contains meaningful levels of potassium, calcium, and magnesium, 3 minerals that independently contribute to blood pressure regulation. Potassium counteracts the sodium-driven mechanism that raises pressure. Calcium supports arterial muscle contraction regulation. Magnesium promotes vasodilation and parasympathetic nervous system activity, the calming, pressure-lowering arm of the autonomic system that should be dominant during sleep. The specific addition that significantly amplifies the blood pressure effect is unsweetened cocoa powder. Raw cocoa is among the highest dietary sources of flavonols, particularly epicatechin, that have been shown in multiple trials to increase nitric oxide synthesis, improve endothelial function, and reduce arterial stiffness. A meta-analysis published in the British Medical Journal found that cocoa flavonol consumption produced clinically significant reductions in blood pressure, with the effect being particularly pronounced in individuals with existing hypertension. Warm milk combined with 1 teaspoon of unsweetened cocoa powder delivers casein peptides, potassium, magnesium, calcium, and a meaningful dose of epicatechin simultaneously, 5 distinct blood pressure-relevant compounds in a single glass, consumed at night when the vascular regulation systems they target are at their most active. Consumed 30 to 45 minutes before sleep. Warm, not hot, which denatures some of the heat-sensitive flavonol compounds. Unsweetened cocoa only, not chocolate syrup, not sweetened cocoa mixes, not drinking chocolate. The flavonol content in those products is a fraction of what raw cocoa delivers, and the added sugar introduces a glycemic response that can elevate nighttime pressure and partially negate the other benefits. 1 cup, 1 teaspoon of raw cocoa, no sugar, 30 to 45 minutes before bed, 3 drinks, 3 distinct mechanisms. Beetroot juice floods the vascular system with dietary nitrates that convert to nitric oxide and dilate arteries during the highest risk hours of the night. Hibiscus tea inhibits the enzyme most responsible for driving blood pressure elevation at the exact point in the circadian cycle when that enzyme is most active. Warm milk with cocoa delivers a combination of casein-derived ACE-inhibiting peptides, vasodilatory minerals, and cocoa flavonols that improve endothelial function and promote parasympathetic dominance during sleep. None of these replace prescribed medication. Used alongside it, the additive effects on nighttime blood pressure, the measurement that research most consistently links to long-term cardiovascular outcomes, are well supported by clinical evidence. A practical implementation note: rotating the 3 drinks across different evenings rather than combining all 3 simultaneously makes it easier to identify which produces the most noticeable individual effect. The nighttime blood pressure response to these compounds varies between individuals based on genetics, baseline arterial function, and existing medication. Tracking morning readings over 2 to 3 weeks after introducing each drink provides useful signal. The optimal consumption window for all three falls in the 45 to 90-minute range before sleep. Early enough for the active compounds to begin circulating, late enough to remain bioavailable through the first and most critical hours of overnight pressure regulation. To close, 1. Warm beetroot juice, consumed 60 to 90 minutes before bed, delivers concentrated dietary nitrates that convert to nitric oxide and produce acute, measurable arterial dilation aligned precisely with the overnight blood pressure window. 2. Hibiscus tea, consumed unsweetened 45 to 60 minutes before sleep, inhibits AC enzyme activity during the circadian window when that enzyme is most active in hypertensive adults, producing reductions comparable to those documented for some pharmaceutical interventions. 3. Warm milk with unsweetened cocoa powder, consumed 30 to 45 minutes before bed, delivers 5 distinct blood pressure-relevant compounds simultaneously, targeting AC inhibition, nitric oxide synthesis, arterial stiffness, and parasympathetic nervous system tone in a single glass. If someone in your life manages blood pressure and has spent years treating it only during the day while the overnight hours go unaddressed, share this. The research on nocturnal hypertension is unambiguous, and the tools to address it should not be sitting behind a paywall or a specialist referral. The nighttime cardiovascular window is not a passive waiting period. It is an active battleground. Now, there are 3 evidence-based weapons for it. For those ready to build a complete system around these interventions, the description has a full nocturnal blood pressure protocol covering the optimal timing sequence for all 3 drinks, the supplement stack that compounds their nitric oxide and ACE inhibitory effects, the sleep environment adjustments that support overnight pressure reduction, and the morning routine that preserves those gains when waking. It was built specifically for adults over 50 who are serious about protecting their cardiovascular system through the night, not just during the day. The link is in the description below or pinned at the top of the comments. High blood pressure does not clock out at midnight, neither should the approach to managing it.